For years it felt like something way off in the future, didn't it?
Definitely. Sci-fi stuff.
But right now,
Yeah.
healthcare is really, it's going through this huge shift.
A seismic shift, yeah.
And we're not just talking possibilities anymore. Artificial intelligence, AI, it's actually here.
Mm-hmm.
And it's changing medicine,
It
fundamentally.
really is.
So today, we're diving into, well, a really core part of that change.
Exactly. We're focusing on how AI is, revolutionizing medical diagnosis.
Right.
We've been looking at some really interesting material, a kind of focused briefing. You could call it the attached text, or CAOK in the original.
Okay.
And it really lays out how AI is reshaping, well, how we find and understand diseases.
So for everyone listening, our mission today is pretty straightforward, right?
Yeah, get to the heart of it.
By the end of this, you'll get how AI is making diagnosis faster, more accurate, and, this is key, making it more accessible for people everywhere.
That's a huge part of it.
Okay, so let's jump right in. What's the sort of basic role AI is playing right now in diagnosis?
Well, the really standout thing is just the sheer analytical power. This attached text calls it superhuman analytical capabilities.
Superhuman, wow.
Yeah, and it means AI can process just vast, vast amounts of medical data, way more than any person could possibly handle.
Okay.
And, with all the data we have in healthcare now, that's becoming, well, essential.
Absolutely. And when we say vast amounts of data, what kind of stuff are we actually talking about?
So mainly things like radiology images, X-rays, MRIs, CT scans.
Visual stuff.
Exactly. And then pathology slides, which are crucial for things like cancer.
Right.
And, of course, electronic health records, EHRs. There's just tons of information in there. AI can sort of pull all that together and analyze it incredibly fast.
And here's where it gets really interesting for me. It's not just speed, is it? The source really hammers home the accuracy point. This idea that it can spot things even really experienced doctors might miss.
Precisely. That's the key. AI algorithms, they're trained to see these really subtle patterns in the data.
Patterns, like what?
Could be, I don't know, tiny little spots on an image, or maybe a weird combination of symptoms in a patient's record that a human might just gloss over.
Okay.
And that means potentially catching things much, much earlier, which, well, we all know how much difference that makes.
Huge difference. And the example in the text about cancer detection, breast and lung cancer specifically.
Yeah, that one jumps out.
It says AI can be as good as, or sometimes even better than, experienced radiologists. That's pretty profound.
It definitely makes you think about what expertise even means going forward.
True.
But, and this is really important, the source also stresses that AI isn't here to replace doctors.
Right, that's a key distinction.
The idea is it's a tool, a really powerful one, to help doctors, to augment what they do.
Yeah. It's like having this incredibly diligent assistant, right, who never gets tired or distracted. This concept of AI being a second opinion, boosting confidence, catching mistakes, is there a good example of that?
Yeah, the text mentions tuberculosis detection. When radiologists use AI to double-check chest X-rays, the accuracy goes up.
How so?
Well, the AI might flag these really subtle signs that a person may be tired at the end of a long shift, or just due to the limits of human vision, might not catch immediately.
Like an extra set of expert eyes.
Precisely. An extra set that's analyzed millions of examples before.
Okay, so AI is the engine doing the analysis. But what's its fuel? The source keeps mentioning data, data, data. How does that work?
Yeah, fuel is a good way to put it. AI, especially machine learning, it learns by, well, crunching massive data sets.
Okay.
We're talking millions of data points from real patient cases. This training teaches the algorithms, the connections, the relationships between different bits of information.
So it learns from experience, kind of.
In a way, yes. Digital experience. And the more good data it gets, the smarter and more accurate it becomes.
Got it. So this patient data goes in. What's happening technically? What are the sort of key AI technologies making this possible?
There are a few key players working together. You've got machine learning, ML, which is the broad field where algorithms learn from data.
Right.
Then there's deep learning, which is a type of ML that's especially good with complex stuff like medical images. It's really powerful for that.
Okay, images. What else?
Natural language processing, NLP. That's how AI reads and understands unstructured texts like doctor's notes, research papers, things like that.
Ah, so it can read the notes too, not just look at scans.
Exactly. And finally, predictive analytics. That uses all these insights to kind of look ahead, assess a patient's risk for developing certain conditions later on.
Wow, so it's not just finding problems now, but predicting future ones. That's huge.
It is. And the source points out that by understanding all these complex links in the data, AI helps move us towards more personalized healthcare.
Tailored to the individual.
Right. Tailoring diagnosis and eventually treatment to each specific patient.
Let's zoom out a bit. The source also talks about the bigger picture, global healthcare.
Yeah.
How can AI help with the disparities we see around the world, access issues?
Yeah, this is where the potential is just enormous, really. Think about it. AI doesn't need a specialist physically present everywhere.
Right.
So it can bring advanced diagnostic help to places that usually lack it, rural areas, remote regions where getting to see a specialist is really difficult or impossible.
That makes total sense. If you don't have a top radiologist nearby, but you have a system that can analyze the X-ray.
Exactly. The source even mentions smartphone apps using AI.
On a phone.
Yeah, helping frontline health workers in, say, low-resource settings identify diseases like malaria or pneumonia just from symptoms or maybe a simple image.
That'd be revolutionary.
It could really help democratize healthcare. Less reliance on super expensive equipment and highly trained people being concentrated only in big cities. Puts more power in more hands.
And this isn't just theory, right? We're seeing this happen now. The source gives some really strong examples.
Absolutely. Real-world stuff.
Tell us about Google's DeepMind Health. What are they doing?
So their AI models can look at retinal scans, eye scans, and detect over 50 different eye diseases.
50?
Yeah, with accuracy that the source says matches or even beats top human ophthalmologists.
That's incredible. An algorithm seeing as well as a top eye doctor.
It really is. Think about the potential for preventing blindness through early detection, just on a massive scale.
Wow. Okay, and IBM Watson for oncology.
Yeah.
Cancer is obviously a huge area.
Right. Watson uses that NLP in machine learning we talked about. It digests a patient's entire medical history, plus all the latest cancer research, treatment guidelines,
Wow.
a massive amount of information. And then it suggests treatment options to the oncologist. It helps them make decisions based on the absolute latest knowledge.
Like a hyper-informed consultant.
Sort of, yeah. And then there's Path AI. What's their angle?
Path AI focuses on pathology analyzing tissue samples under a microscope, which is vital for diagnosing cancer accurately.
Okay. Their AI tools help pathologists do that analysis more accurately and faster. Getting that diagnosis right and getting it quickly is critical for starting the right treatment.
So it's speeding things up and making them more precise across the board.
Pretty much, yeah, from screening to treatment planning.
So looking forward then, what does the future hold? Where is this all heading?
Well, the source suggests healthcare becoming even more personalized, treatments really tailored to your specific genes, your lifestyle.
Hyper-personalization.
Exactly. And think about wearable tech watches, sensors. We might get real-time diagnostics, AI giving you an alert instantly if something's wrong.
Wow, like a check engine light for your body?
Kind of. And we'll probably see AI integrated much more smoothly into doctors' workflows, decision support systems where the human and AI collaborate seamlessly.
Sounds amazing.
Yeah.
But there must be challenges, right? The source mentions things we need to be careful about.
Oh, absolutely. Big ones. Data privacy is huge. We're talking about incredibly sensitive health information. Security has to be rock solid.
And ethics, I guess. Bias in the algorithms.
Definitely. Ensuring these algorithms are fair, that they don't reflect biases in the data they were trained on. Transparency is important too, understanding how the AI reaches its conclusions.
And getting regulatory approval, making sure it's safe and effective.
All crucial hurdles. We need clear rules and standards.
It's a powerful technology, no doubt, and needs careful handling. But overall, the feeling from the source seems pretty optimistic.
Yes, definitely. The potential benefits are immense. With careful work, continued innovation, proper oversight, AI looks set to be an incredibly valuable partner in keeping us healthy.
Okay, so if we were to boil it all down, what's the main message from this deep dive into AI and diagnosis?
I think the core takeaway is that AI isn't just tweaking things around the edges. It's fundamentally changing what's possible in medical diagnosis.
Redefining the possibilities.
Exactly. From catching diseases earlier to creating truly personalized treatments to potentially leveling the playing field in healthcare access globally, it's a major shift.
A revolution happening right now, as we said. Not some far-off dream, and it impacts all of us. So maybe a final thought for everyone listening. As AI gets woven ever deeper into our healthcare experiences, how might that change the actual relationship? the human connection between patients and doctors in ways we might not even be thinking about yet.
That's a really interesting question to chew on. How does technology change the human side of medicine?
Something to definitely keep thinking about.